Ladies and gentlemen, thank you for standing by and welcome to the LA County COVID-19 update. At this time, all participants are in a listen-only mode. Later, we will conduct a question-and-answer period. Instructions will be given at that time. If you should require assistance during today's conference call, please press star followed by 0, and an operator will assist you offline. I would now like to turn the conference over to your host, Dr. Barbara Ferrer. Please go ahead.
Thank you very much, and good afternoon, everyone. I want to start by thanking the supervisors, the entire board, for their support and their leadership during these unprecedented times. And folks know that today was our board meeting, so I really want to acknowledge how forcefully they've actually united the entire county in really all of our efforts to slow the spread. And I also want to give a big shout out to our sign language translators, who are, you could see they're sort of they have in a different place, but Rory and Neil, it's been a pleasure working with both of you, and I'm glad that you're making information accessible to many people throughout our communities. I want to update you on our current status. I'm sad to report today an additional 40 deaths. This is tragically the highest number of deaths that I've had to report for any single day. And I know that this represents lives that have been lived with close families and friends who are now mourning this terrible loss. 25 of the people who passed away were over the age of 65, and 17 of the people who passed away who were over the age of 65 had underlying health conditions. 9 people who died were between the ages of 41 and 65, and 5 of these people had underlying health conditions. There are 6 cases for which we don't have information today, and those are the cases that are being reported by the City of Long Beach. Those are 4 deaths, and 2 deaths that are being reported by the City of Pasadena. This brings the total number of deaths to 360 throughout LA County, and our mortality rate for COVID-19 once again has crept up to 3.6%. For the 292 deaths where race and ethnicity has already been identified, 16% of the people who died were African American, 17% were Asian, 34% of the people who died were Latinx, 32% were white, and 2% of the people who died identified as belonging to a different race or ethnicity. Each day that I report these numbers, I know that there are families and friends that are coping with terrible loss. And I hope you know that we mourn with you and we keep you every day in our thoughts and prayers. Today, we're also reporting 670 new cases. As I noted yesterday when I reported a significantly smaller number, I was very much aware that that was the Monday report from the labs when we don't have a lot of testing over the weekend. And we did anticipate that we would continue to see an increase in cases throughout this upcoming week. Over the last 48 hours, there have been 909 new cases. This brings our total to 10,047 cases in LA County. These cases include 350 people who were reported by our partners in the City of Long Beach as being positive for COVID-19, and 164 people reported by the City of Pasadena, both of which have independent city health departments. We're also reporting that out of our total number of positive cases, there are 26 confirmed cases amongst people experiencing homelessness. The majority remain unsheltered. There were 4 people who experienced homelessness who were sheltered, and they are appropriately isolated, and their close contacts are quarantined. 2,517 cases have at some point been hospitalized. This is 25% of all of our positive cases for COVID-19. There are 1,433 people currently hospitalized with COVID-19, and 33% of these people are in the ICU, and 20% of them are on ventilators. And I want to apologize for the incorrect numbers that we reported yesterday. We had a couple of issues transposing data in our report yesterday, so our apologies. You can see updated report on our cases on the Department of Public Health's website. That's publichealth.lacounty.gov. We're currently investigating 199 institutional settings where there's at least one confirmed case of COVID-19. We added 13 investigations since yesterday. These are investigations that are happening at nursing homes, assisted living facilities, shelters, treatment centers, supported living, group homes, and correctional facilities. The total number of confirmed cases in institutional settings is 1,596, and this includes both staff and residents. 850 of these confirmed cases are among residents, and 746 are among staff who work at the institutional facilities. And I'm really sad to report that 109 residents have died in the institutional settings. This includes our skilled nursing homes and assisted living facilities, and this represents 31% of all deaths. Yesterday, we also mistakenly reported the numbers for confirmed cases in the jails, and we apologize. We have absolutely had a problem with Monday's report, and instead of reporting just on the jails yesterday, we reported on the total number of cases among all incarcerated institutions. So today's numbers are accurate, and we're reporting a total of 64 confirmed cases in the jail facilities. This included 11 cases among inmates and 53 cases among staff. The Sheriff's Office is reporting that currently there are 9 inmates who are incarcerated who have tested positive. 2 of the 11 inmates that we reported have since recovered. 26 inmates are in isolation, and 559 folks who are incarcerated in our jails are quarantined. There are 29 cases in the state prisons. This includes 19 inmates and 10 staff. And there are 4 cases in our juvenile facilities. These are all among staff. We do post a list of facilities with confirmed cases on our website once they've notified the staff, the residents, and the families. And with the spread of COVID-19 across the county, we continue to see an alarming increase in the number of cases amongst residents and staff at our institutional settings. And I do want to note that we recognize that staff at these facilities need to make sure that they have adequate personal protection equipment so that they can support the infection control practices that are best, and that the county is working hard to ensure that these facilities can do their very best to protect the healthcare workers and the residents. The Los Angeles County Sheriff's Department is reporting 34 positive cases among staff. There are 435 staff that are quarantined, and 254 staff have returned to work. The LA County Fire Department is reporting 16 positive cases among staff. There are 19 staff that are quarantined at their homes, 3 who are isolated and are sick, and 13 who have returned to work. And I want to again thank Sheriff Villanueva and Chief Osby for tracking and reporting this data. And to all of the staff that are first responders, we thank you for all you're doing in our communities. Over 63,000 people have been tested in LA County, and the results and had their results reported to us. 11% of all people tested have been positive. Our total number of tests, reported tests, increased by over 10,000 people yesterday. And this now means that we've included most of the negative results we were delayed in getting. And although testing capacity, as you've noted, continues to increase, testing is still recommended only for those people who are symptomatic. And I know we've been talking yesterday and even late last week about the positive impact Safer at Home has had. And there's a lot of messaging I know that's happening on the national news channels about reopening the country. But I do want to remind everyone that we're not yet on the other side of this pandemic. And we've all worked together amidst many difficulties and challenges to find ways to reduce the spread of COVID-19. But we're going to need to keep up our efforts to avoid a surge in cases that will overwhelm our hospitals. We don't want to lose ground. For LA residents, this means that we need to keep doing what we're doing. We need to stay home. We need to physically distance. We need to use our cloth face coverings when we're out. And we need to self-isolate and self-quarantine when ordered to do so. These tools are essential now, and they will remain essential as part of our toolkit until we have therapeutic medicines and a vaccine. But we do know that it is time to think about modifications to the health officer orders, and this will come as we work to continue to slow the spread. So we're planning for our recovery, and this allows us to think about what pieces need to be in place in order for us to safely relax our Safer at Home order. When we relax the orders and people are out and about more, we also know there'll be more cases of COVID-19, and we need to have a strategy to make sure that we don't see a steep acceleration that will overwhelm our county. We need to avoid having that surge of cases and deaths that overwhelms the healthcare system, causes more tragedies, and forces us back to reinstating some of the restrictions. So our goal is that as more places become open and we're able to relax some of the health officer orders in the future, we don't get to a place where we're going to need to close them again. So in order to safely relax our Safe at Home orders, we need to focus our efforts over the next few weeks in 4 different areas. The first is we need to continue to work, and under Dr. Galley's leadership, this county has done a tremendous effort to make sure that we can care for people who are sick and or people who need health care services. This includes making sure that we can accommodate preventive health care in LA County so that children and adults can receive their immunizations and their necessary dental services. Having a healthcare system that can provide all of these services is only possible if we ensure that all of our healthcare workers have the personal protective equipment they need to do their jobs safely. So that's part of our work as we plan for the recovery. Second, we need to be sure that we're able to protect the people who are most vulnerable to serious illness and death from COVID-19. This includes people in nursing homes and assisted living facilities, people experiencing homelessness, and people who live in communities that are under-resourced, have less access to health care, and have higher rates of underlying health conditions. Third, we need to have widespread capacity for people to be tested for COVID-19, and then the ability for people to safely self-quarantine and self-isolate. This means increasing the number of places that can provide testing, including places in our under-resourced communities, as well as increasing the capacity of our labs to process the tests in a short amount of time. This also means that we need to have resources for people to safely self-isolate and self-quarantine away from their families, especially if it's difficult for this to happen in their homes. And lastly, we are going to need to have very good plans in place that allow us to continue physical distancing once more businesses are open, and that will ensure that our public and our employees remain as safe as possible. This will continue to require that people are 6 feet or more apart, that they wear their cloth face coverings, and that infection control practices are adhered to at every single site. Reopening safely will be different for different business sectors, and we're looking forward to working with all of these sectors over the next few weeks to create directives that ensure the safety of workers and customers when we get to the other side. I do want to share with you all that the goal of getting people back to work in a safe manner is paramount, but we need to make sure as we do this, we don't cause a huge increase in cases, forcing us to order massive closures again. I want to close with a little bit about the importance of transparency during the pandemic. Members of the press have rightfully asked for more information on cases and deaths, especially those that are happening in institutional settings like nursing homes and assisted living facilities. And first, I want to thank the media for thoughtfully reporting on this issue and many of the complex issues that arise during the COVID-19 pandemic or are arising. It's fully our intention to be as transparent as possible in reporting information. We need to always weigh this with privacy considerations and also data accuracy. But we're working towards posting more information about cases at institutional settings. And we appreciate your concern about making sure that we continue to look at ways of understanding which communities are overburdened with both deaths and morbidity associated with COVID-19. I thank you for your reporting. We're grateful to you for keeping the public informed about how the COVID-19 pandemic is impacting our county. And with that, I want to introduce Mr. Garcia, the Public Defender for LA County.
Good afternoon, and thank you, Dr. Ferrer. I also want to take a moment to thank the Board of Supervisors for their incredible leadership in this time and for truly being beacons in protecting the indigent and underserved members of our community. In this time of crisis, we are often measured, and we will be measured, by how we treat and consider those who are the least fortunate in our community and the least cared about. And our board has done an exceptional job of showing that that part of our community is an absolute priority to them and should be to every Angelino. As a Los Angeles County Public Defender, I'm here to talk to you about protecting our communities and making them safer and protecting them, let me do that again. I'm here to talk to you about protecting our communities and make them safer while also saving people in detention facilities during this time of the COVID-19 pandemic. Here in Los Angeles, I have worked with the district attorney, the sheriff, the courts, and other justice partners to lead the way to safely and responsibly reduce the amount of individuals in our county jails. I want to emphasize that those releases have been releases that take public safety into consideration as a paramount factor, and releasing individuals safely into the community is everyone's concern, mine as well as the justice partners. Together, we have collaborated to safely reduce the risk of mass exposure to more than 3,500 individuals who are currently no longer in our jails. Those individuals were released safely to allow them to benefit from the same protections that you and I have in our communities. Many of these individuals were pretrial and presumed innocent, and while 3,500 seems to be an exceptional number, it is only the beginning, and we must do more to protect the men and women in our jails. To stem the spread of this deadly virus, we must do something significant to reduce the number of people in our jails and limit new admissions to exceptional circumstances. We must do so now amid this critical moment in the peak in the virus here in Los Angeles County. We all know too well this is a matter of life and death. As we think of the extraordinary precautions we are all taking, such as social distancing, wearing masks, and constantly washing our hands, and remaining at home, we must remember that right now, thousands of people are trapped in close quarters with no ability to take these basic precautions in order to protect themselves. Our mothers, fathers, grandparents, children in custody are as afraid of COVID-19 as any of us. In juvenile camps and halls, youth are vulnerable because they live in close quarters, and their communities, and their opportunities for treatment, programming, and educational services which lead to rehabilitation are limited due to this pandemic. As such, we must look for opportunities to thin out the numbers in the camps and the halls, to allow for social distancing, and to allow our young people who are eligible for release the ability to receive services safely in their homes and in their communities. I have asked the juvenile courts to accelerate hearings rather than conduct business as usual. I have asked probation department to work with us on a task force to find meaningful and significant pathways so that the youth may be released into our communities in a safe and diligent manner. I also want to indicate that our immigration unit is working with communities around Los Angeles to protect the rights of those individuals who are here regardless of legal status. We are also a location where individuals within the community can access information throughout Los Angeles so that they can protect themselves in this time of crisis. I'd like to take a moment to acknowledge the bravery and the dedication of frontline deputy public defenders and all public defender staff countywide who are in court every day protecting their clients' rights and their liberties. The men and women who work in the public defender's office are in court and in jails talking with individuals to make sure that in this time of crisis, their voices are not heard, and that in this time of crisis, the Constitution is not thrown aside out of fear. I want to thank you very much for your time and dedication. And now, would you please have a moment, Anna? We're now ready for questions.
Sure. Ladies and gentlemen, at this time, if you would like to ask a question on the phone lines, please press 1 followed by 0. Again, if you have a question on the phone lines, please press 1 followed by 0. And our first question comes from Colleen Shelby with LA Times. Please go ahead.
Hi, thank you for taking my question. Wanted to know if you could expand a little bit on how people are reporting the number of testing, if those are coming directly from commercial labs and hospitals once a day. Just curious how that's being collected, since I know we saw a spike in numbers today reported.
Yeah, that's a great question. So we get it multiple different ways. All labs, hospitals, and providers are required to report positive results for COVID-19 and for other diseases to the Public Health Department. The easiest way for us to obviously get these reports is directly from the labs through what we call an electronic lab reporting system. That worked well, except for the fact that we have some new labs here who weren't on the ELR yet. And we've been working really hard to make sure that the new labs could, in fact, report to us electronically. Providers also report to us, and hospitals report to us. So obviously, we have a team of people that go through to make sure that we remove duplicate counts from the total of the test results that we're reporting. And again, a reminder, we report results. We don't actually report the number of people tested. But we'll take the next question.
Our next question comes from Dave Lopez with Channel 2 News, KCAL 9, Los Angeles. Please go ahead.
News and KCAL News. Doctor, good afternoon to you. I'm sure you know that the governor spelled out plans to slowly reopen things. A little bit, that's the right word to use. He would not pinpoint a date. He did say 2 weeks is critical. I'm wondering if, A, you can give a better date, if you agree with the 2 weeks. And my other question, Doctor, is can we just figure out, or can we assume that even though we're going to ease these restrictions, we are going to live under some type of order, some type of restrictions until there's a vaccine?
Yeah, those are great questions, Dave, and thanks for both of them. I think the governor and the county are very much aligned in noting that we have to have plans in place that allow us to ease some of the restrictions, but we have to do that in a manner that's as safe as possible. And that means doing a lot of planning starting now over the next few weeks so that when we do safely lift some of the restrictions, we're not going to end up with huge increases in cases that puts us back to the exact place we were at the beginning of the pandemic and what we've been trying and successfully avoiding up till now. So I think the message is pretty clear. I think in this state and certainly with the leadership at our board, that we will make plans so that everyone understands we're headed for recovery, but we will not ease restrictions until there are safeguards in place that make sure that our healthcare system can in fact respond to any increase in cases, that we have the appropriate distancing measures and infection control processes and protocols in place at every business that does reopen so that both the public and employees are in fact protected, that we pay particular attention to where we know we have people very vulnerable for high rates of disease and unfortunately high rates of death, and we do a better job on offering protections at those settings, and that we address the fact that at the heart and soul of reopening is making sure that when people get ill, it's very easy for them to get tested. They get a test result pretty quickly, and if the test result is positive, they're immediately able to isolate and their close contacts are able to quarantine. Once we reopen, we have to do everything we can to still make sure that infected people are not infecting others. So we do want to reopen. We want to reopen safely, but those 4 areas we need to sort of shore up our ability to make sure that we're doing that work correctly. So no, I don't have a timeline or a date similar to the governor. I think the next couple of weeks are critical. I think every week is critical, and every week shows us how well we're doing to slow the spread. But thanks for your question. We'll go on to the next question.
Our next question is from Claudia Peshuta with KNX Radio. Please go ahead.
Hey, Barbara.
Hi, Claudia.
I heard what you said about the data. I just have to point out we really need help with that. Yesterday and today, you said 4 cases among juvenile detention staff. Leyva said it was 6 yesterday. Probation now tells me it's 5 at the juvenile hall in Sylmar. So I'm not sure which number to go with. Also, 199 institutions are under investigation, but there are only 100 listed on the DPH website. Outbreaks are no longer being noted. And I'll just reiterate that we would like to know about deaths reported at particular institutions. A second matter, I'd like to get more details about the outbreak at the DCFS facility. I'm told that's Starview in Torrance. Is it still 14 cases, 1 child, and 13 staffers? I'm wondering what's happening to the kids served by that facility, and if anyone is in quarantine and isolation at this point, how many? And also, a third matter, who's in charge of testing? Is it Dr. Kazan? We haven't heard from him for a while. I'd like to get an update on the strategy for ramping up testing and what the goals are at this point. Thank you.
Okay, thanks a lot. Let me start with the DCFS facility. As we reported yesterday, there are 14 cases, 13 are among staff, and 1 is a juvenile who is staying at the facility. Our staff is working to make sure that there's appropriate quarantine and isolation, and I can get back to you with more details on exactly what that looks like. I don't have the numbers of people who are being quarantined at that facility, but we can certainly try to provide you with an update on that. In terms of our data on institutions, we are working really hard to make sure that what we post is accurate. So one of the reasons why we stopped with the asterisks is we found out in a couple places it wasn't accurate. The time lags are really hurting us because people are often moved around to hospitals and then moved back. So we promise to actually create a much more informative grid about what's happening at the institutions that includes both information on staff and residents, both for those who are testing positive and those who are persons under investigation. So that means that they're ill and we're awaiting test results, or we're assuming that they may be COVID positive and treating them as such. And we'll also include deaths. But that's going to take our team another few days to make sure that we have a mechanism for determining that the data is accurate. There's a lot of data that comes in, and I know you can appreciate this. We want to do our very best to report accurately, but these are moving pieces, and oftentimes reports, we report on data at a particular point in time, and that data changes 2 hours from now or even an hour from now. And some of the differences between what gets reported for people in institutional settings is, for example, the sheriff's numbers today on the number of inmates that are positive is different than ours. Ours is cumulative, and theirs is who is incarcerated today who's positive. And so we just have to get better at being able to understand the nuances and figure out ways to make sure we're accurately reporting. I appreciate your patience with this, but there is a lot of data that's coming in. And then the third question on testing and who's in charge, Dr. Kazan is in charge. He's now working closely with folks from the Department of Public Health who, I believe starting next week will be playing a more central role in expanding testing capacity, but building obviously on the amazing work that Dr. Kazan and his team has done and continuing to partner with the fire department. I'm happy to see if he's available later this week to come and give an update on testing. We'll take the next question.
Our next question comes from Tony Barboza with LA Times. Please go ahead.
Hi, thank you. My question is about whether the issue of overcrowded housing factors into your response or messaging at all. For example, have you seen any correlation between communities with higher levels of overcrowding within housing units, any correlation between that and those that also have higher rates of confirmed cases? Do you believe this plays any role in driving up infections? And just kind of, are you at all worried about the virus spreading more easily in communities that do have higher rates of overcrowded housing?
Yeah, it's a great question, Tony. I mean, we have a team that's trying to get more detailed information around patients who are hospitalized so that we could actually look at the conditions in which they've been living. Right now, and hopefully we'll have some reports out at the end of the week. Right now, we're just using a proxy, which is really we look at density in terms of housing by zip code or by census tract. We actually do it by census tract. And we're trying to, again, see what the differences are in these geographic regions that we've already started reporting on. So we already try to report our case counts by those regions. We're trying to see if we can align labs and then if we can align hospitalization data. But we're not there yet. It's a big task in terms of merging different data files. I think it's a great question, and I know that we're as concerned as you are about trying to better understand the conditions that make spread easier. Obviously, everything we know about this virus means that the closer you are in contact to other people, the easier it is to spread, particularly if it's really difficult to take and to practice sort of the infection control processes we try to describe the most. So I don't think you're off to think that there's going to be some relationship, but I also want to account for the fact that we have amazing residents who live in LA County who are doing just amazing and creative jobs at trying to create those social distancing, that physical space wherever they're living. And I want to thank everyone for doing their very best in spite of what could be difficult housing situations. But we'll look at that, and hopefully we'll be able to give more detailed information over the next couple of weeks. We have time for one more question.
And our last question comes from Josh Haskell with KABC-TV. Please go ahead.
Hey, Dr. Ferrer. I was just hoping that you could talk a little bit about, you said 63,000 have been tested, but only 11% positive. Can you just elaborate a little bit about that 11% and what your read is of those numbers? And then the folks that are coming back negative, that 89%, do the majority of them have the flu? Can you just tell us a little bit behind those numbers? And can you speak at all to this emergency ordinance that was just passed by county supervisors to protect retail, grocery, drugstore, food delivery workers? I know they may not presently be there with you, but anything you can say would be great.
Okay, I'm going to do better on the testing questions. I'm not going to be able to speak to the supervisors, except that, again, I want to note their leadership on really protecting all of us has been instrumental in being able to slow the spread. And I'm sure they'd be happy, any one of them would be happy to talk with you after this about the motion that just got passed. I am happy to talk about the testing issues. Yes, you're right. It's now, we're back down to about 11% of people who have been tested have a positive result, which means the vast majority of people, 89% of them, have a negative result. This has been somewhat consistent since the beginning. We had a problem with having some negative lab results that weren't reported to us that created this spike last week where we were getting up to about 14 or 15% of all the people getting tested were positive, but we noted at the time that we were missing close to 20,000 negative results for people. And once we put those in, we're back down to about 11%. Most people who are getting tested are people who ought to be symptomatic, but there's lots of other reasons for people to be ill right now. And I think for everyone who is ill and they're working with their provider, the clinicians are deciding that the symptoms are such that it warrants testing. So I think, again, this says that a lot of people here in LA County do not have COVID-19. They may be sick. They should still stay home when they're sick. But a lot of people do. 10% of our population is 1 million people. So if you just want to say that 10% of people getting tested are positive, that means that we could have as many as 1 million people at some point in time who may be infected here in the county. And so while it seems like a relatively small percentage of those getting tested, it's still, because we're a large county, a very large number of people who may be capable of infecting others. And then we have all the people who aren't getting tested, who may be asymptomatic and still able to pass on the infection. So I'm going to hold with our advice, which is that everybody needs to use universal precautions at this time. You should assume that you may be able to infect somebody else, even if you have no symptoms, and that somebody else who has no symptoms may be able to infect you. So do all of the physical distancing, wear your cloth face coverings, make sure that if you are sick, you're isolating yourself, and if you're asked to quarantine, please observe the quarantine orders. And with that, we're going to close the English portion of our press briefing, and we'll move to remarks in Spanish. Buenas tardes a todos. Gracias a toda la Junta, toda la Junta de Supervisoras a través de estos tiempos sin precedentes nos han guiado con fuerza y compasión. Quiero agradecerle especialmente a nuestros traductores de lenguaje de señas que están aquí para cada sesión informativa. Rory y Neil, ha sido un placer trabajar con ustedes dos. Muchas gracias. Para actualizarlo sobre nuestros números hoy estamos tristes de reportar 40 muertes adicionales. Las 25 de estas personas son mayores de 65 años y 17 personas mayores de 65 años que fallecieron tenían problemas delicados de salud. Las 9 personas tienen entre 41 y 65 años y 5 de estas personas tenían problemas delicados de salud. Esto eleva el número total de muertes a 360 en el condado de Los Ángeles y nuestra tasa de mortalidad para COVID-19 es 3.6%. Para los 292 muertes donde se identificó la raza, las 16% son afroamericanos, el 17% son asiáticos, el 34% son latinas, el 32% son blancos y el 2% fueron identificados como otra raza. Cada día cuando informamos estos números, sabemos que hay familias y amigos que lloran la pérdida de alguien a quien aman. A todos ustedes estamos de luto como ustedes y ustedes están en nuestros pensamientos y oraciones cada día. Hoy también estamos reportando 670 casos nuevos. Hay 2.517 personas que han sido en algún momento hospitalizados con COVID-19. Esto es 25% de todos los casos positivos. 1.433 personas están hospitalizados actualmente y 33% de estas personas están en la unidad de cuidados intensivos y el 20% están en ventiladores. Puedes ver el informe actualizado de los casos del Condado de Los Ángeles en el sitio web del Departamento de Salud en publichealth.lacounty.gov. Actualmente estamos investigando 199 entornos institucionales con al menos un caso confirmado de COVID-19. Las 13 investigaciones adicionales desde ayer. Estos incluyen hogares de ancianos, instalaciones de vivienda asistida, refugios, centros de tratamiento, viviendas de apoyo e instalaciones correccionales. El total de casos confirmados de entornos institucionales es de 1.596. Y esto incluye 850 personas que son residentes y 746 personas que son empleados. Nos entristece informar que los 109 residentes han muerto por COVID-19 en estos entornos. Esto incluye instalaciones de enfermería especializada y vivienda asistida. Estos representan el 30% de todas las muertes. Ayer informamos con un error los números inexactos para casos confirmados en cárceles y nos disculpamos, pero los números de hoy son precisos. Estamos reportando 64 casos confirmados en las cárceles. Estos son 11 reclusos y 53 empleados. Hay 29 casos en las cárceles estatales y estos son 19 reclusos y 10 empleados. Y hay 4 casos en instalaciones juveniles, todos entre el personal. Más de 63,000 personas han sido evaluados y se han reportado resultados en el condado de Los Ángeles, y el 11% fueron positivos. Aunque la capacidad de prueba continúa aumentando, en este momento todavía estamos recomendando la prueba solo para aquellos que son sintomáticos. Quiero también hablar un poco por el tiempo que nos queda frente para estar aquí con fuerza para que vamos a llegar al otro lado de esta pandemia. Estamos muy seguros que el impacto está positivo de la más seguro en casa, los órdenes que son los más seguros en casa. Y hay muchos mensajes hoy en día en las noticias nacionales sobre la reapertura del país, pero quiero recordar a todos que todavía no estamos del otro lado de esta pandemia. Y todavía tenemos que trabajar juntos para reducir la propagación de COVID-19. En el condado de Los Ángeles, esto significa que debemos seguir haciendo lo que estamos haciendo. Quedarnos en la casa, distanciarnos físicamente, usar cubiertos de tela para la cara y aislarnos y ponerlos en cuarentena. Estas herramientas son esenciales ahora y seguirán siendo esenciales hasta que tenemos medicamentos terapéuticos y vacunas. Y ahora tengo un placer de traer acá a hablar con ustedes el señor García, que es el Public Defender del Condado de Los Ángeles.
Buenas tardes, soy Ricardo García, el defensor público del Condado de Los Ángeles. Quiero hoy hablar de un poco a ustedes con lo que está sucediendo en las cárceles aquí en Los Ángeles. Yo he trabajado con la Fiscalía, la Corte y otros compañeros de los otros socios de justicia aquí para asegurarnos de liberaciones seguras y responsables en el condado. Juntos hemos colaborado para reducir de manera segura nuestras cárceles en más de 3,500 personas, muchas cuales están encarceladas antes de juicio y que se presumen inocentes. La importancia de reducir la cantidad de gente en las cárceles es porque en situaciones en que viven en esa situación junta pueden más fácilmente infectarse con el virus de corona. Lo que estamos haciendo es asegurarnos que la gente encarcelada tenga las mismas opciones que nosotros tenemos aquí en la comunidad, porque ahí encarcelados no pueden distanciarse efectivamente, no pueden ponerse máscaras para protegerse, ni a veces lavarse las manos, ni tener básicamente los recursos que tenemos nosotros aquí fuera. Lo que queremos hacer es reducir las cantidades de individuos en la cárcel para que ellos puedan hacer lo mismo que hacemos nosotros en esas condiciones de protegernos bajo el coronavirus. Los encampamentos de jóvenes están bajo las mismas situaciones. Tenemos jóvenes encarcelados que no pueden tener tratamiento, no tienen oportunidad de programación ni de servicios educativos, mientras que esperan poder salir. Necesitan esas condiciones de rehabilitación para poder salirse de la cárcel y estar libres y recibiendo programas en la comunidad. Hemos pedido a los tribunales de menores que aceleren las audiencias y a lograr realizar asuntos para que los jóvenes puedan estar fuera y permanecerse en sus casas y recibir los tratamientos necesarios para rehabilitarse. También hemos trabajado y formado un grupo que va a trabajar con las Cortes y con el Departamento de Liberación Condicionales para asegurar que los jóvenes que estén fuera tengan los recursos necesarios para mejorar su condición académica y social. Quiero tomar este momento para agradecerle a los trabajadores, los abogados y los demás del Departamento de la Defensoría Pública que cada día entran a la Corte y trabajan mano en mano con la gente acusada de algún delito. Ellos están trabajando bajo condiciones muy peligrosas, pero siguen ahí para asegurar que la Constitución y las protecciones de los individuos acusados no sean olvidados. Muchas gracias, les agradezco el tiempo y ahora, and now, Armenian remarks.
Բարի երեկո։ Գուզենք թարմացնել LA շրջանի ընթացիկ գարկավիճակի վերաբերյալ։ Մենք այսօր ցավով հայտնում ենք 40 անձերի մահվան մասին, որոնց 25-ը 65 տարեկանից բարձր են, իսկ 17-ը նրանից հիմքուն ունեին այլ առողջական վիճակ։ 9-ը 41-ին 65 տարիքի մեջ են, իսկ 5 նրանից հիմքուն ունեին այլ առողջական վիճակ։ Դեղեցություն չունենք մյուս 6 դեպքերի մասին, քանի որ դրանք հայտնում են Long Beach քաղաքի, որը 4 հատ է եւ Pasadena քաղաքը 2 անձիկ։ Սա հանգեցնում է մահացությունների ընդհանուր թվին 360 Լոս Անջելես շրջանում եւ մեր մահացության մագարտակը COVID-19-ի համար գազմում է 3.6 առ 100։ Ամեն օր երբ մենք հայտնում ենք այս տվերը, մենք գիտենք, որ կան ընտանիքներ եւ ընկերներ, ովքեր սկում են իրենց սիրած մեկի գորուստը։ Դուք մեր մտքերի եւ աղոթքների մեջ եք։ Այսօր մենք հայտնում ենք նաեւ 670 նոր դեպքի մասին։ Վերջին 48 ժամվա ընթացքին գրանցվել է 909 նոր դեպք։ Ընդհանուր առմամբ Լոս Անջելես քանթիում կա 10047 դեպք։ Այս դեպքերը ներառում են Long Beach քաղաքում մեր գործընկերների կողմից գրանցված 350 դեպք եւ Pasadena քաղաքի կողմից գրանցված 164 դեպքեր, որոնք ունեն անկախ առողջապահական բաժանմունքներ։ Հոսպիտալացման տվյալները 2517 դեպք հոսպիտալացվել է, որ բոլոր դրական դեպքերի 25%-ը կգազմի։ Ներկայումս 1433-ը հոսպիտալացված են։ Այդ մարդկանց 33 առ 100-ը գտնվում է ICU intensive խնամքում, իսկ 20 առ 100-ը օտապոխիչների վրա։ Տեստավորում ավելի քան 63000 մարդ փորձարկվել է եւ ստացել են արդյունքների մասին լուրը LA County-ում, որոնց 11 առ 100-ը դրական է։ Չնայած փորձարկման կարողությունը շարունակում է աճել, այս բահի մենք դեռ խորհուրդ ենք տալիս թեստեր անցկացնել միայն սիմպտոմատիկ անձանց համար։ Մենք մինչ խոսում ենք այն մասին, թե ինչպես դրական ազդեցություն է ունեցել ավելի անվտանգ տանը եւ երկիրը վերապացելու մասին ասկային լուրեր շատ կան։ Ես ուզում եմ բոլորին հիշեցնել, որ մենք դեռ դրա մյուս կողմը չենք։ Մենք բոլորս միասին աշխատել ենք դժվար եւ ստեղծագործ ձևերով COVID-19-ի տարածումը նվազեցնելու համար։ Բայց մենք պետք է այն բահենք, որպեսզի խուսափենք մեր հիվանդանոցը ճնշող դեպքերից մեծ թափ հավաքելուց։ LA County-ի համար դա նշանակում է, որ մենք պետք է շարունակենք անել այնինչ մենք անում ենք մնալ տանը ֆիզիկական հեռավորությունը, անցվերոցիկի դեմքի ծածկոցները օգտագործելը եւ ինքնամեկուսացումը։ Այս գործիքներն այժմ անհրաժեշտ են եւ կմնան էական, քանի դեռ մենք չունենք բուժական թեր եւ պատվաստանյութ թերը։ Ինչ է անհրաժեշտ, որպեսզի սկսենք հանգստացնող պատվերներ։ Մենք նախադեсում ենք մեր վերականգնումը իմանալով, որ մեզ համար դա անելու համար պետք է լինել որոշակի գտորներ։ Նախքան մենք կարողանանք ապահովորեն հանգստացնել մեր ավելի անվտանգ տանը պատվերը։ Եվ մենք թույլատնում ենք պատվերը եւ մարդիկ դուրս են մնում եւ ավելին մենք գիտենք, որ COVID-ի դեպքեր կլինեն։ Որպեսզի ապահով կերպով ապահովենք մեր տան անվտանգությունը, մենք պետք է վստահ լինենք, որ կարող ենք հոգ տանել հիվանդ մարդկանց եւ կամ կարիք ունեն առողջապահական ծառայության։ Եվ վերջապես մենք պետք է ունենանք լավ պլաններ, որպեսզի շարունակենք ֆիզիկական հեռավորությունը եւս մեկ անգամ բիզնես բացվի, որը կապահովի ինչպես աշխատողների, այնպես էլ հանրության անվտանգությունը։ And this will conclude our press conference.
And ladies and gentlemen, that does conclude today. Thank you for your participation. You may now disconnect.